Hi, my name is Nikki Jicha, and I'm going to be doing a presentation on my paper. The focus is the impact of simulation-based training on nursing students' confidence and competency in managing a postpartum hemorrhage. So briefly, I want to introduce what a postpartum hemorrhage is and how it leads to morbidity and mortality rates in pregnant women. So a postpartum hemorrhage is when a woman delivers a vaginal delivery and has more than 500 milliliters of blood loss, or a C-section where they lose more than 1,000 milliliters of blood loss. That is classified as a postpartum hemorrhage. So basically, I wanted to touch upon this topic because I do believe nursing students do struggle with the fact that they might not be able to see a postpartum hemorrhage during their clinical rotation. And it is a very scary and emergent situation, and you do need to know how to act during this emergency. So, the purpose of my paper is to focus on how simulation-based education really helps students focus more on skills than theory, where they learn more of what the problem is. And I believe simulation-based training will help them learn how to act during this emergency situation. So, a little bit of background and rationale. So, traditionally, clinical training is very limited to exposure of emergencies, like I had mentioned. It really does focus more on like patient safety concerns rather than the emergency situation. So, I believe that simulations offer a safe and controlled environment for students to practice these emergency situations where they're not going to harm a patient if they were in the clinical setting. The most important part of simulation-based training is helping students gain the confidence and competency in improving maternal-child outcomes during an emergency situation. Next, I believe simulation-based training in nursing education can help define a student and how they react during emergency situations. So it's very helpful that these students are using high functioning mannequins that can perform in a way where they can experience a postpartum hemorrhage. These mannequins can bleed, they can deliver a baby, they can do many other things such as code blues, they can seize. There's lots of emergency situations that they can do. I also believe that role playing during a simulation is very helpful. So, an educator, as myself in the future, can assign students different roles, such as being a family member, being the primary nurse, being a doctor, being a laboratory specialist, anything. You can give them the role, allowing them to succeed and learn while doing the simulation. Simulations are also scenario based. I think this adds different realism to the scenario as well as allowing them to mess up in a controlled environment that's not going to harm a patient. So during the simulation, it's really important for students to take it very seriously since this could be their patient's life on the line in the clinical setting. So, immediate feedback during the simulation. The educator can stop the simulation and be like, what did we do wrong here? What can we fix? What can we learn from this event that happened? And this allows for them to have a debrief. Debriefing, I believe, is very, very important in the nursing field as we see so many different scenarios, not only postpartum hemorrhages, but just anything in nursing. We should always debrief on a situation. Simulations also help improve clinical judgment for students, which sounds very odd since they're not in the clinical setting. But simulations do allow for students to make those judgments in a safe, controlled environment. It also allows them to work with a team. You're going to be working with team members regardless of where you work. So it's really important for these students to learn how to work as a team. Also, it helps them be prepared. Being prepared is great. You're never going to be prepared for your first postpartum hemorrhage. It's always going to be scary, but at least you get to touch upon it before it actually happens to you. So, another thing that I would like to touch upon in my paper was the impact on confidence. Students have said that they feel more confident and more prepared when they are performing these simulations because it helps them act in high stress scenarios. Students don't always get to see things in clinical. They don't. It's really sad. And when they do experience it, it's very scary. So, simulations also help reduce anxiety. When I experienced my first postpartum hemorrhage, I was very, very anxious and very, very nervous. So I wish that in nursing school, I had the simulation to help me gain my background. It also does help improve decision making, as I have touched upon before. It also allows the students to have more of an assertive intervention to a postpartum hemorrhage. All right. Moving on. So the impact on competency, it really does enhance technical skills in students. Simulations allow them to do fundal massages on a patient. It allows them to do fluid resuscitation. It allows them to learn how to hang blood in an emergency situation, which I think is very, very helpful. It allows them to start IVs. It allows them to talk to doctors and lab and family members, educating the patient on what's going on during these emergency situations. I do believe communication and teamwork, as well as leadership, are very important skills to learn during nursing school. So, some challenges and some considerations that I would like to touch upon are it is very costly to get these mannequins. So, schools can apply for grants. They can have students do fundraisers. There's many different ways that these schools can raise money to obtain these mannequins. Another thing is the need to train facilitators or educators to perform these simulations. You do need somebody that knows maternal child health to perform a maternal hemorrhage for students so that they can learn and understand from someone who has experienced it. It is also very important that you structure your debriefing with your students. Students might not understand what was going on in the moment, and it's very important as an educator to sit down, talk to them, have them understand what went right and what went wrong, and where they can improve. Lastly, I would like to touch upon simulation-based training and how it really does significantly impact nursing students in their confidence and their competency. I was one of the first groups at Stanbridge to use the maternal child simulation room that they built right before we graduated, and it was very, very helpful experiencing contractions, contraction patterns, delivering a baby, resuscitating a baby, having a postpartum hemorrhage, or even feeling for cervical checks. I think that is the most important thing for a student to learn during that clinical setting. I think that it really does help prepare nurses to respond effectively to maternal emergencies. Some people don't understand what a postpartum hemorrhage is, especially if they've never experienced one, and it is a very scary and very emergent situation. In the future, I think it's important to integrate simulations into more of the curriculum for nursing students, combining it with the professional training and the conduct of longitude studies with theory and clinical, as well as simulations. I would really like to speak upon having that experience and being a part of the simulations at Stanford University, and I believe it did make me a stronger nurse. Thank you.